Hello, everybody, and welcome to Mariah Sanctuary. I'm Mariah. Today's live stream is on the suggested topic of ADHD in women. All the information below came from the uh, Psych Central website in the article ADHD in Women uh, versus Men. Does gender play a role in symptoms? People of different genders experience ADHD in unique ways. But further studies are still needed to uncover exactly why and how. Attention deficit hyperactivity disorder, ADHD, affects people of all gender identities, but ADHD impacts folks of each gender differently. While ADHD appears to be more common in males, females are often underdiagnosed or misdiagnosed due to differences in symptoms. Understanding that gender differences in ADHD may help you become more aware of symptoms present among women and girls versus men and boys. Prevalence of ADHD in women versus men. Is ADHD more common in males or females? The answer is tricky. According to the for Disease Control or Prevention, or CDC, 12.9% of men and boys live with ADHD compared to 5.6% of women and girls. ADHD is just as prevalent in girls, but is underdiagnosed due to different factors, says Julia Edwards, a licensed mental health counselor and an ADHD certified clinical services provider in Iowa. Diagnosis: boys and men are more likely than girls and women to be referred for services, even when their symptom profiles are exactly the same, says Edwards, noting that leads to higher diagnosis rates for boys and men. A 2019 study suggesting that ADHD diagnosis may be more easily missed among females due to the diagnostic process. Females are also less likely to be prescribed medication and receive a diagnosis because um, they don't typically display the disruptive external symptoms associated with ADHD. Of course, we know that is different for each individual. Like for me, I don't show the telltale signs, so probably why I was misdiagnosed. Sorry, my ADHD wasn't very prevalent. People couldn't really see it, and also I do suspect that my autistic side masks my ADHD a lot. So, yeah, that's just a personal experience for me. Um, Based on Edward's experience living with ADHD, back to what I was saying, based on Edward's experience with living with ADHD and working with folks who have it, she's noticed that different rates of diagnosis are often attributed to factors with cultural and gender bias and expectations. Due to the due to the lack of education of ADHD in women and girls, Edwards says they are more likely to be improperly diagnosed with other mental health conditions like bipolar, personality disorders, depression, and anxiety. For me, myself, I was misdiagnosed with having borderline personality disorder because some of, I guess, the ADHD, being an ADHD and being autistic, maybe looked more like those, but they were wrong. For adults, the diagnosis process can be complex because it has to be very thorough, Edwards says. The later in life people try to seek a diagnosis, the more they have to take into consideration comor comor sorry, I'm also dyslexic, so give me a second. it's comorbidities. I think it's how you say it. My bad if I said it wrong. All these notes will be under the live stream once I'm done. Trauma and medical conditions, etc. Edwards notes that a mental or medical health professional typically refers someone for ADHD testing. Then they'll undergo a thorough psychological interview and various cognitive testing exercises to try to receive a diagnosis. The age of onset. The age of onset of ADHD symptoms is typically before the age of 12, but can be as early as 2 to 3 years old, Edwards says. She notes that boys tend to show an early onset than girls because of the presentation of symptoms. A 2021 study on adult onset ADHD suggests that symptoms that present later in life could be due to childhood symptoms that were not addressed by a medical professional, among other factors. Edwards says that ADHD is a lifelong neurodevelopmental condition, which means that people don't just grow out of it. But symptoms can change over time, especially with an early diagnosis and proper treatment. When untreated, symptoms can intensify during teenage years because of hormones, said Edwards, or Edwards adds. For example, changes in estrogen can affect the intensity or presentation of ADHD symptoms at later stages of life, such as puberty, monthly menstrual cycles, peri men my brain is sorry guys, let me do that again. I think it's menopause and menopause. I guess there's two different ones. I'm sorry, my bad. Edwards has noticed that the diagnosis rate in women between the ages of 30 and 45 has been rapidly increasing, particularly in recent years due to the pandemic-related changes in structure and environment. As a therapist specializing in adult ADHD, about 90% of my ADHD clients are women who have been diagnosed later in life, she adds. Symptoms. ADHD symptoms differ depending on a person's gender, age, or other factors. I personally don't believe that there are significant differences in symptoms between men and women, Edwards says. What's different is the behaviors and presentation of the same symptoms because of the structural and functional differences between the male and female brain, she says. ADHD symptoms in women and girls. According to Edwards, women are less likely to be externally hyperactive and impulsive than men. She notes that internal hyperactivity in women can be in the form of overthinking, intrusive thoughts, and negative self-talk. Other internalized symptoms are of inactivity, distractibility, and hyperactivity among women and girls with ADHD may include maladaptive daydreaming, anxiety, depression, spacing out during conversation, easily losing focus, auditory processing disorder, forgetfulness, eating disorders, hypersexuality, impatience, body focused repetitive behaviors such as skin picking, hair pulling, and leg bouncing, fatigue, insomnia, crying with deep emotion, anger, and feelings of guilt and shame, shyness due to social anxiety, and sensory difficulties. They may also experience the following symptoms of rejection, sensitivity, dysphoria. You have perfectionism, people-pleasing, codependency, body dysmorphia or negative body image, low self-esteem, overachieving or underachieving, intense emotional interactions, and overwhelm. And then we have the breakdown of ADHD symptoms in males and boys. On the other hand, boys and men with ADHD are more likely to show external symptoms like hyperactivity, example fidgeting, um, disruptive behavior, frequently losing items, interrupting others during conversation, aggress- aggressive behaviors, high risk behaviors, for example, substance misuse, speeding, un- unhealthy sexual behaviors, and excessive financial spending. Edwards notes that RSD or um, rejective insensitivity dysphoria can present among men in the same intensity as women. Men can also experience low self-esteem and insecurities, but most times it's externalizes as anger, apathy, self-centeredness, sensing seeming insensitive to other people's emotions, teasing others, or being sarcastic, needing to be right or proving others wrong, defensiveness. And of course, we know for each of these symptoms for men and women, uh, there can be outliers. So people can have some of the symptoms men have, and people that are men. So women can have some of the symptoms men have, and then vice versa. Men can have some of the symptoms women have because it depends on how your ADHD affects you. And I know that's not in my notes, but that is what I do believe that. Um, Edwards notes that heightened emotions or emotional dysregulation for males can look more like temper tantrums or anger outbursts too. There are many men who are emotionally sensitive, and because of gender bias, they experience shame for being in touch with feelings instead of meeting society's expectations of being tough or strong, Edward says. Uh, the next fun unscripted live stream will be on Monday, March 31st at 4 p.m. Eastern. And of course, I've changed the time from 6 p.m. to 4 p.m. for my Monday streams for anyone who watches them. And the next scripted live stream will be Saturday at um, April 5th at noon Eastern, and it'll be on the suggested topic of trichotillomania. And this was a suggested topic. Thanks for everyone who watched. Love you guys. Bye.